John Scallions is here with us today. John is the nurse practitioner and PAD specialist for Southern VIP. He works alongside Dr. Thomas Hodgkiss and Dr. Scott Osborne at Southern VIP and Foot Rescue. So welcome to the show, John.
Thank you so much, Emily. It's a pleasure to be here. Thank you for having us.
Absolutely. We are glad to have you. So, we mentioned PAD, so explain that to us and what Southern VIP can do for people who are suffering with this.
PAD can be a sneaky little disease. It stands for peripheral arterial disease. This is caused when plaque or blockages start to build up on the inside of the arteries of the legs and into the feet. This plaque consists of fat, cholesterol, sugar, and as those arteries start to narrow, it can cause symptoms in our patients. These symptoms can be vague on the beginning with some numbness, burning, and tingling in the feet, cramping in the legs, cramping when you're walking, and then could advance into worse symptoms such as developing a wound down on the feet or amputation, which we don't even like to say that word at Southern VIP.
What if someone has been told that they need an amputation? Should they stop there?
Absolutely not. When you hear the word amputation, always go and get that second opinion. We do that all the time. Come in and talk to us, because if you do need an amputation, we may be able to limit the amount of amputation by restoring blood flow down to that area and therefore healing that tissue nearer the area that you're having an issue with.
Yeah, and in your practice, you talk about foot rescue. So explain this more to us.
That's the feather in our cap, Emily. Most vascular centers treat to the knee or just below the knee. Southern VIP, we have a procedure called foot rescue, where we have the technology to be able to go all the way down to the bottom of the feet, restoring blood flow in what we call the pedal loop. Pedal means foot, and then the loop of arteries around the foot. And this is a really tricky little artery where many diabetics get closure in. So if we can get that open, patients usually start saying their feet feel warmer, less cramps, their balance is even better. So it's a really nice procedure to have in our pocket.
But talking about procedures, do patients always need a procedure?
No, and that's also a good question. When we come in for a vascular conversation, as I like to call it, consultation sounds a little sterile, so I like to have a conversation with my patients, to where you may be able to start a walking or a cycling program to really challenge those arteries and push more blood flow down to the feet, increasing your numbers. You even start to develop even smaller arteries to help that tissue. So we'll try that sometimes for 3 months, but if it's further, if the symptoms are more advanced, then we discussed angioplasty or atherectomy, which helps remove that plaque from the arteries.
And maybe give a message to those who might be watching who think they might be struggling with this.
If you are having these symptoms, even the most vague of symptoms, and you have issues like diabetes, you're a smoker, high cholesterol, anything like that, hypertension, go and get assessed. It's all about early prevention.
Yeah, I know early prevention is key.
100%.
So where can our viewers go if they want to set up an appointment?
Okay. SouthernVIP.com has a great deal of information with all of our therapies and all of our phone numbers. You can also call 731-207-8070 and talk to one of our patient coordinators who will get you to the right clinic.
All right, John, thank you so much for joining us.
Thank you. This has been great. I really appreciate it.
Absolutely.
Yeah.